Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I am going to answer a question asked by a viewer. What is DNA test and why it is important to do a DNA test in pregnancy? So actually there is no test called DNA test, but we advise genetic evaluation in pregnancy. So usually when the pregnancy is advancing properly, we assume that everything will be normal. But certain things like genetic conditions can be picked up on the ultrasound scan or certain blood tests which are called as double marker test, triple marker test or even NIPT test. So these tests are used for genetic evaluation of the baby during pregnancy. So when is the right time to do these tests? So usually first genetic evaluation happens around 12 weeks time, where we advise the patient to undergo a TIFA scan or NT scan. So this NT scan evaluates the baby structurally. It looks at the nasal bone, nuchal translucency. It also looks at the certain heart conditions which are developed by that time. So it is a very important scan for evaluation at 12 weeks. Other than the NT scan, at 12 weeks, what we advise is double marker test or triple marker test. So along with these blood tests and the scan evaluation, it is called as combined test. So the report is given as a combined test, which includes the measurements of your baby of your NT scan and also includes these blood tests, double marker or triple marker test. So this combined report gives us the risk for the baby if the baby has higher risk of having a genetic disease, especially aneuploidies like Down syndrome, Edwards syndrome, Patau syndrome, or certain neural tube defects. So these conditions can be detected early at 12 weeks time by these tests. Now, second time when we do genetic evaluation is around 16 weeks. So these women who might be having higher risk in the genetic evaluation, they are further advised to undergo invasive testing, which are diagnostic. So the test which we discussed so far are called as screening test. Means it is not the 100% diagnosis that the baby is affected, but we can screen and find out which women at higher risk of having this condition. So when we find out the high risk women for these conditions, like women maybe of higher age, about 35 years of age, or women who may have genetic diseases, these are high risk women. So these high risk women then advised to undergo either NIPT or invasive testing like CVS, chorion villus sampling, or amniocentesis. So amniocentesis is a test where we take out the fluid around the baby and we send it for genetic testing or if any infection screening. So these tests, which are invasive tests, are advised only to screen positive women, and it is not done for everybody. Then the second important genetic evaluation is done around 20 weeks. So this 20 weeks time is very important because majority of the organs of the baby are well formed and we can evaluate the baby's brain, heart and all other structures at this time. So this is also known as second trimester TIFA scan or anomaly scan. So anybody who we find at having some abnormal reports in these tests, again those women are advised invasive tests like amniocentesis to diagnose the condition. If these invasive tests like amniocentesis gives us the diagnosis that baby is affected, then these women then can be advised to either undergo medical termination of pregnancy or they are guided to meet high risk obstetrician along with fetal medicine specialist for further management based on what is the finding of these tests. I hope this was helpful, and it is important to undergo these tests for complete evaluation of the baby so you can have a healthy pregnancy. Thank you.